Unshelling Medicine Podcast. Healthcare in the language we understand.
Hello, everybody. Welcome to another great episode of Unshelling Medicine. Today, I have the pleasure of sitting here to discuss something very important. I know I say that a lot, but people in healthcare, people in life in general, you will appreciate today's discussion. So I have Jesseca Tighe with me. Jesseca is a career and life coach. We all could use that. So hi, Jess. How are you?
Hi, I'm great. Thanks for having me.
Thanks for being here. So tell us about yourself, how you got into life and career coaching. What are the things that you see? And let's get into it.
Yeah, thank you. Yeah, so I'm a career life and leadership coach. Prior to that, so I spent many years in mental health. I have a PhD in psychology and then transitioned to working in healthcare. And I was an executive in healthcare for about 13 years and watched my soul slowly die and got really burnt out. So that happened. But I also really wanted to work with people again, one-on-one. And I always knew I wanted to go back to practicing. So almost a year ago now, I made the transition to start my own business and start meeting with people as a career and life coach. So I work mostly with people in healthcare. I have a lot of nurses. I have other people that are working in senior living, whether it's in sales or line staff. I work with people in the dental industry, but really people come to me who are in high stress jobs who don't really want to quit what they're doing because they love it. They got into these careers because they want to help people, like we kind of said before we started recording. And they don't want to quit, but they really want the job to work for them. They feel like the job's working them. They're not working the job. And they want some relief. They want to de-stress. They want more time with their families. They want more balance. So those are the kinds of things that we talk about, is either to make it work for them, or some people are coming looking for a career change and looking to discover what their life purpose is, and then shifting towards that. So that's what I do. And it's wonderful. And I'm so glad I made the switch.
I'm happy for you. So, making the switch is often very scary for most.
Oh,
right?
yeah.
Because,
Oh, yeah.
we talked about this just a little bit before the call. It's like, there's the fear of the unknown, and then there's the proverbial silver, golden, or bronze handcuff that is a salary, a steadiness, with income. What would you say to somebody who may be floating around the idea of possibly stepping out of what they're currently doing right now to actually expand their skills in a way that they know they can expand for a broader audience reach, right? Without the soul-sucking activity that, often comes with most,
Oh, yeah. Healthcare jobs. Yeah.
that one.
Yeah. Good question. So, I mean, for me, I knew that having an executive level position and being on call 24/7 and working 60, 80 hours a week, I knew I couldn't start a business like that. And so what I did was I took a step back. I actually took a marketing position where I was still working part-time, but I was working a lot less hours and I wasn't on call. And that was a huge, huge shift. So I had to take a step back. I really wanted this to work. I really wanted this dream to work. So that was kind of the first step. And then it transitioned into just making the finances work for me and my family, and taking other odd jobs while I was building this business, kind of doing this part-time, doing other things part-time, kind of having this motley thing. And now I'm doing this full time, and it's happened in less than a year. So it actually didn't take as long as I thought it would. But it's just figuring out. And when I work with clients, we figure out kind of what are your sacred cows. What can you not give up, or what do you really have to make, or what can it look like? And then start making a plan and executing that plan. And that's just what I did, and it ended up working out. And I definitely haven't replaced my salary yet, but I'm so much happier. My family's happier. My son is happier. I mean, it's just, there are so many other things other than finances that are so good about this. The balance isn't all about the finances, and I know people worry about that, but when I work with people about making a career change, it's also about those other things, about what they're wanting out of life, what they're wanting, what they want balance to look like for them. What does that actually look like? And that's where I started. I started there. What does it actually look like for me? And then started making a plan and just taking one small step at a time.
One step at a time. Every journey begins with a step. You just, you have to do something somehow.
That's
Um,
right.
how do you help the professionals who are very invested in their roles? I mean, we all work hard to get to where we are, or where we
Mhm.
get in life, be it investment in education, investment in, the career itself, from training and, dedicating yourself to go to conferences and taking on those extra roles that eventually, leads to promotion, right? So
Mhm.
how do
Mhm.
you help professionals who are married to their role, who are married to their position of prestige, right?
Yeah.
So at the thought of not having that level of recognition, or the salary that comes with it, or the proverbial respect that comes with it, how do you manage work through that stuff? If your career defines you, or your position defines you, but you're not happy, you just want to make a change.
Yeah, yeah. So I would say my clients kind of fall into those two categories. The ones who are, really want and need to make a change, and then the ones who really do want to just make the job better for them. And I'll talk about the prestige and money part in a second. But so for the clients that I work with, 90% of them do not change their career, and do not, they might go to a different job, but they actually don't change their career. And I was not expecting that result, because a lot of people do come to me saying, I'm burnt out and I can't take it anymore. And then through our work together, they find something that actually works for them, and they find a way to put some boundaries around their work that makes it work for them and gets things more back in balance. Because healthcare, the boundaries can just get blurred so easily, and the job can just creep into all aspects of your life so easily, because we're taking care of other people, and that's what we do and that's what we want to do, but then we lose ourselves in the process. So I help those folks create some boundaries and make the job work for them. Then there's the other folks who are like, no, I really do want a career change, I just don't know where to start. So like I said, what happened to me, we make a plan. We look at what their end goal is and what their strengths are and what they actually want to do, and walk them through some career coaching. But as far as the prestige, the money, I mean, all of that's ego. That's all just, ego BS. And I understand it. Like I have a higher level degree. I have sunk cost fallacy, yeah, dripping all over, because it's like, well, I have this degree, I should be using it. And when I was in healthcare, that's what I thought. Like, I really should go back to working with people because I got this degree, I paid for it. I should be doing something else. And now that I'm doing this, I'm like, well, I should go back to healthcare, and I should be making more money, and I should be making exactly what I was making, and all the things. But it's all that's just ego nonsense. And once you name that and label it like that, and really parse out what that cognitive bias is for yourself, then you can, it's no longer the monster under the bed. It's known, and it's a known factor. And you can just put that to the side and just say, no, I'm not going to let that be a data point in my decision making. It doesn't need to be there. We can talk about what balance looks like for you in your particular circumstance, and maybe it is the salary, and that's okay. Like it's all right to need money. That's our hierarchy of needs. Like we all have to feed ourselves and feed our families and have a roof and have a car. Like there's nothing wrong with that.
Mhm.
But when you cross the line into wanting it for money's sake, or then we start getting into ego stuff, and we can parse that out. And I think most people who work in healthcare, at least the people that I work with, can pretty easily do that. They know what that is. That we're not.
We
I
know
have
our
yet to meet the psychopath
we know our
who
demons.
who comes to life coaching, or who's in healthcare trying to help people. Like I have not yet to meet that person. So I think most of us know that if we come here to take care of people, but we also have to take care of ourselves. And it's just finding where those lines are, and creating boundaries around that.
Right. I'm curious for the people who come to you wanting a change and ending up going back, not changing the career and still staying in the
Mm-hmm.
industry, right? So what is
Yeah.
that like? Like what is the knob that was like the knob or the switch? Whichever
Yeah.
floats anybody's boat. If you like switches, good for you. If you like knobs, yes. What was that tuning like?
Yeah, it's a good question. So the people who I work with, I would say, like I said, they come, they say, I'm burnt out. I'm working so many hours. I like parts of what I do, but I can't work these hours anymore. I'm not seeing my family. We're on the verge of divorce. Like there are really huge consequences for having the jobs that we have and not having boundaries around that. So I think what it is once they start working with me and getting some relief, then that's really what the switch is. Once they start getting some relief, setting some boundaries around work, actually start learning what rest really looks like for them and doing it, what really feeds them and nourishes them in terms of self-care. Once we figure that out and they get some space around it, then we start asking the question, like, okay, well, what do you really want your life to be like? And then we kind of work backwards. We work backwards from there. And so a lot of people find out, like, I really do have a lot of the skills that match the job that I have now, and I like what I'm doing. And maybe this isn't the right company, or maybe I just don't have the right boss because they kind of suck and they're a micromanager, and ain't nobody got time for that.
Nope.
And and but they don't necessarily want to change their career. Maybe, like I work with a lot of nurses, and maybe it's switching that up. So instead of, I had a nurse that worked on the trauma unit, and she's
Right.
like, I'm going to go be a pediatric nurse in an office for a minute. And she's so much happier now. So she's still doing the career that she chose. And of course, she uses that training every single day, but her life is just so much more in balance now. And she's so much happier just having that slower pace. And I think it's okay to do that every once in a while. You don't have to burn yourself out and stay in these high stress jobs. You can take a step back, and you can always go back or take extra shifts or
Yeah.
something like that. You don't have to stay there forever. We can't stay there forever. It's not sustainable for our bodies as humans to stay in that high stress state. We can't do it. It's not normal.
It's not normal, and we've found a way to normalize it, which is why we have a lot of chronic conditions. We have a lot of, mental breakdowns. We have a lot of anxiety situations. We have all this stuck energy level of, disorders going on.
Mm.
It's not normal. If anybody listening, please, it is not normal. If it's stressful, step back, reevaluate things, and see what options you have. Which brings me to our next question. You kind of, you're talking about it, about your manager sucks. So what degree, what degree and how much responsibility do you think management and leadership have with frustrating the living daylight out of somebody in their career that they so willingly signed the agreement to embark on, to the point that they are contacting you like, Jessica, help?
Mm-hmm. Well, it's 100% the employee and 100% the management.
Mm,
It's like any other relationship.
right.
And the manager is responsible for the outcome of that relationship, just like I'm responsible for the outcome of my marriage. I'm responsible for the outcome of my relationship with my son and my family, right? Like we are all 100% responsible. I think that the trend in healthcare has been for a long time to put the responsibility on the employee in terms of it's a lot of handbooks say the employee has to stand up and report when something's wrong. Well, that might not be emotionally safe for them if, if because we there are a lot of bosses out there that don't know how to be bosses, quite frankly. And, the
Can
worst
you
boss,
repeat that part again?
yeah. Yeah, they don't know how. They got promoted to a management position and then got handed the keys and said good luck. And that's on the responsibility of the industry and the people who hired that person to not give them any skills and just say you'll be fine. That's wrong too, in their defense. But once you become a manager of other people and you have other people's lives in your hand, it's your responsibility to make sure that that relationship has a positive outcome. And instead, there's this trend towards it's all the employees. It's their responsibility to speak up. If they don't speak up, then everything's fine, or just you don't have to do anything with it. And I think that that's incorrect and that's wrong. I think that the managers, and I have a lot of managers that I work with on creating cohesive teams and breaking through some of those barriers, which is really fun for me because I think that it's a mistake to say to the employee, it's all on you, it's all your responsibility. And if you don't tell me something, or if you're not happy and you don't tell me, then it's not my fault. And that's just wrong. It's that we don't do that with any other relationship. We other industries don't do that to their employees. So I think that is the one thing that needs to shift in order to create more employee satisfaction, is for managers to just say, I'm responsible for the outcome of this relationship. I'm going to treat you nicely. I'm going to ask you if you're okay. I'm going to, like, it's not a secret in healthcare. We're all overworked. We're all burnt out. So it's not a secret. It's okay to say, hey, you worked a lot of hours on this project last week. Why don't you take Monday and Tuesday off? You worked the hours, or how can we work it out where people aren't getting so burnt out? Or you picked up 5 or 6 extra shifts last week. Like, I know you want the money. How about we figure out something else out so that you can get the money that you need and that you want, but I don't want to burn you out. I don't want to lose you.
Mm.
How can we create some of those incentives so that employees actually do stay? I think that's on the management. That's not on the employee.
Even with incentivizing, the occasional pizza and T-shirts that happen a lot in healthcare,
Oh yeah. Oh yeah. Well, you mean my pajamas? Yeah, I have lots of those.
you know, you get those token.
Yeah. Yeah.
I think just one step further in that responsibility, manager, employee responsibility is also the importance of being an active listener, right?
Yeah.
That is lacking in most of healthcare, and also the cliques that form, and bad and toxic behaviors are tolerated just because
Mhm.
people are socially connected to each other outside of the workplace.
Mhm.
That breeds, I've seen that breed a lot of toxicity, losing very talented employees, and also the fear of retaliation just because there's
Mhm.
that knowledge that this person is connected outside of here. Once one person is made an example out of, it takes a negative toll through the team. And that is
Mhm.
part of, in addition to a very stressful work environment, having that extra level of angst and anxiety of being retaliated against if you actually say something is very stressful. Would you say
Yeah.
you've seen that happen?
Oh, absolutely. Absolutely. I mean, and it's so hard. I always say you're a manager of moods and attitudes. That's what you're doing. And I think that there's a way again, it's all about balance. If there's a group of friends at work is a good thing. A gossipy clique is not necessarily a good thing. And it's all about balance, right? It's all about putting those boundaries up and making sure that everybody's in it for the right reason and that there's nothing negative going on. And when something negative is going on, I mean, then healthcare, we've decided that we're just going to manage to two things: the financial statement and the employee handbook. And that's all we're going to do. And that's the only responsibility we have. We're not going to talk to these people about how important their relationships are, or how important, their, even the gossip can be, there can be some truth to it, or there can be a reason for it. Maybe they're doing something to protect themselves because of other things going on. And there are also all sorts of nastiness happening in healthcare, in terms of people are like with race relations, or people are from different countries or different minority groups. I mean, it might not be a clique, it might just be they're trying to create some emotional safety for themselves. And there's nothing wrong with that. It's just that you, as a manager who's maybe outside of that cultural group, it's your responsibility to understand it and to have some empathy for that and figure out how to manage to those people without saying that type of social group is wrong. I kind of went on a tangent, but
No, worst tangents ever, because you covered so many aspects of that, because it can have both negative and positive connotation. However,
Mhm.
we want to ensure that everything is managed positively as much as possible, because it gives to the survival of the team, it gives to the growth of the team and the collaboration and collaboration of everybody. It makes things more enjoyable. Like, I don't
Yeah,
want to dread going into my next shift,
right, right.
right? The only dread that should come about going into my shift is like, okay, I have done, back to back 412s, right? So
Yeah.
that should be it, right? Not like, okay, who am I working with? Okay, this person is this way. Okay, I'm going to risk being reported or complain.
Mhm.
It shouldn't be that, right?
Yeah,
So clicks are good to a
absolutely.
certain degree, yeah.
Absolutely. Yeah. Well, and if there are employees targeting each other, of course that's not good. And there are ways to deal with those people too who like to target other people for sport. And I'm not saying all employees are, wonderful and golden. They're not. I've had to free up people's future before,
Mhm.
and because it's just, it was not working out, and they were breaking the rules, and their presence was no longer supportive of the patients or the team. And that's just the end of it. Or they did something super egregious, like
Mhm.
abusing a patient or something.
Right.
Like, I'm sorry you're gone. Like, I'll miss you. Like,
I don't think you would, Jocelyn. Just don't think you would miss them. It's like, I wish you well. So, in the concept of career coaching, right? When should a person consider a career coach or a life coach? Because when we talk about career coaching or life coaching,
Mhm.
there's this general kind of like outlook that, oh, it's for people who are seasoned in their career. I'm too young. I'm too new in my role. I don't even know where I want to go. So, right now, I may not need a coach until I get to that senior executive position, or I'm at my wit's end. This is when I need the help. When should a person really consider a career coach or a personal coach?
Yeah. Well, let me talk a little bit about what coaching is like versus traditional therapy, for example. So let me start there. So traditional therapy, which I've definitely done before, I've practiced before and also gone to therapy before, and highly recommend. But therapy is more about your past and understanding your past.
Right.
Coaching is more about your future and being future focused and putting in skills so that you can meet your goals,
Right.
whether regardless of the type of coaching that you're going into. So that's the main difference. So when I would say when someone needs a career coach, I mean, I work with people who are in college
Right.
and are like, I just don't know. Like I'm thinking about this and I'm thinking about that, and it's a really difficult decision. Like it's the rest of their lives. They don't want to make an investment that isn't going to make sense in 10 years down the road. And we're kind of in a time when a lot of younger people are really questioning the efficacy of higher degrees. So I completely understand that. So I think it's anytime you want to focus on your future, you don't know what you don't know, you have some gaps, and that's what a coach is for. Whether it's a trauma coach, whether it's a life coach or life purpose coach or career coach, anytime you're questioning what the future is going to look like and you're not sure how to get there, that's the time to get a coach. Does that happen? Absolutely not. People come way too late when they're suffering and they're burnt out and they've made some mistakes. They've gone down a wrong road and they're not quite sure what to do or how to handle it or even how to stop themselves and stop that momentum. That's just human nature. But a lot of my clients have been in traditional therapy before. They're coming because they want this skill set in terms of making work for them, because nobody teaches that really. So
True.
yeah.
So basically, in essence, don't wait until you're dying to seek the help.
Right.
When you feel something's coming on, like a little sore throat or, possibility of being exposed, seek the help. It helps kind of like, and it's great that you're working with high school students or college students as well, because that is where you kind of like start, even if you haven't decided yet, but certain areas start piquing your interest, right? And it's
Right.
a good time to kind of like delve in and like dissect, things to a level that you can digest at the time, right? I had a group of clinical students. It was one of the funniest experience I've ever had. So towards the end of the clinical group, the hospital was one that was very student friendly, and I was allowed to kind of like fan out my students to different specialties so they can kind of like experience different specialties and decide what they wanted to do. And throughout the course of the clinical rotation, kind of like taking in personalities, taking in work ethics, taking in different things. And the two students I sent to the emergency room, one was very high spirit, very, spritey, very, that was her. I'm
They're
like,
ready to go.
you know,
Oh, to
I'm
have that energy again. Ooh.
just meditated to come to you, Jessica. So, so I'm like, okay, perfect, emergency room. And then the other one that was very much laid back, very monotone in the way she talked, the way she moved, the way she just, she was just that kind of personality. I'm like, let's see, because she went to another specialist she wasn't really a fan of. So I'm like, okay, let's just test it out. Okay, both of you emergency room today. At the end of the clinical day, and we were post-conferencing, and it's like, oh, how was your, anybody willing to talk about your experience today? And the first person that piped up was my very high energy student. It's like, Professor, I know for a fact I do not want to work in the emergency room. I was so shocked. I'm like, no, you? It's like, no, too fast paced. I can't remember. I couldn't think. And I'm like, you don't usually think, but okay, you found what? When did you start being a thinker? So it's like, well, in my energy, I still find pockets to like analyze. It felt like I couldn't, right?
Yeah.
So, energy and energy doesn't always mix. So something might seem very interesting and very fun, but it may not be for you. And on the flip side, Miss Monotone was like, this is my specialty. I know exactly what I'm going to do.
Wow, that's so neat. Yeah, I think knowing what doesn't work and is just as important as knowing what does work. Like that's okay. That's how we make decisions. So I think that's brilliant.
Yeah.
Yeah.
I just working with the younger generation, in hindsight, I wish I had that, right? But
Yeah.
at the same time, it's kind of like I wouldn't take back the experiences that I've had, both the good, great, and not so good ones, because it really shaped me and funneled me into what I know I'm good at, right?
Yeah.
So could it have helped cut off a lot of the noise? Yes, it would have. I would have
Yeah.
appreciated it. So I think, understanding generationally what is needed so we can avoid the pain of revolving door of hiring. And
Yeah.
what industry in your experience of career coaching do you think have the higher fire rate?
Well, I'm not familiar with all industries, but I mean, healthcare is super high. I mean, I think at least my personal statistic in our agency, it was 80% pre-COVID, 180% post-COVID. And I think that there's a lot of reasons for that. It's not all relationship based. It's the incomes and salaries are not matching cost of living. And so of course someone's going to go down the street for another couple dollars an hour. Or, this healthcare, I mean, the buying and the selling, and you have a new CEO every other quarter and a new boss every other day. I mean, it's just the chaos really feeds into that too. I mean, there's all sorts of reasons why there's turnover. But there's a saying, among a lot of my friends, the names don't change. It's just the logo on the business cards.
My goodness, I'm gonna steal that. Wow.
Yeah, and it totally is. And I mean, I have to, go through some of my business cards of some of my friends. I don't even who knows? I'll just go on LinkedIn to figure out where you're working today. But it makes sense. So there's so much opportunity and so many opportunities for companies to do better by their employees. And I think people are just getting curious about that and signing on to these positions. And there's nothing wrong with that. I get frustrated with companies that are saying, we're going to do it the way we've always done it. They haven't seen a patient in 20 years, but they're going to make decisions about how that employee treats that patient.
Yeah.
That's not right.
Yeah.
I think those are the kinds of cultural shifts that if we start to make those, I think we can start to see higher employee satisfaction and lower turnover rates.
Absolutely.
But that's just the world according to me.
But it's not you though, because the more I have these conversations with different people, especially in the healthcare space, who do different things, the more there's a correlation, right? Healthcare is very buttoned up. Again, I've said this over and over. It's very buttoned up. It has the nuance of the old boys club, is who kind of feeling. However, somebody said something the other day that in order for us to fix healthcare, we have to break the system and rebuild it in a way that everybody has a say and everybody is held responsible in the same manner. We've patched it for the longest time, right?
Yeah.
When we're making those high level decisions that affect everybody, right? That trickle down effect. Everybody that is affected should be included in that decision making, right?
Yeah.
It shouldn't be about the bottom line and the employee handbook, right? It should be everything in between, right? So from the nursing staff in general to the support staff to the physician, the nurse, like everybody, the social work, everybody needs to be involved, right? So how do we function effectively and still affect the bottom line in a positive way? All at the same time still gaining employee satisfaction. It's possible. It's not fairy tale. It is possible if everybody has a seat to make the decisions that matter, right? It's this whole thing. It goes with the whole thing with the clinical testing industries. Like, oh, there's no diversity. There's no diversity. Excuse me. There's no diversity because you keep going to the hospitals and the doctors for diversity. You're not going to the communities that have suffered atrocity over history, right? You're not talking sincerely, and you're not being transparent. So you're not going to get diversity, right? You're always going to have drugs that are, ready for market. When it's out in the market, it works this way with this group of people. You would have found that out if this group of people were included in clinical trial. We all have to be.
Oh gosh. Oh yeah. I mean, don't get me started. I mean, the clinical, I have my piled higher and deeper degree. So I did these clinical trials. The problem is that the researchers want to account for every single variable. Mm-hmm. So they push everybody out, but that's not regular life. You want to push out everybody who, we're not going to include anybody who drinks, even has one drink a year. Yeah. It's like, well, that's not regular life. It's about to be Christmas.
Thank you.
Like a lot of people who don't drink are going to have a drink of alcohol. You can't just push out an entire group. You can't just push out entire groups of ethnicity and culture and backgrounds just to try to find just to make your data clean. That's not humans. I don't know what the answer is, but I know it's not what we're dealing with. We all know that it's a problem. And based on what you just said, because we get different data when actual human beings start taking these medications and having these different outcomes. Mm-hmm. It's like, well, why? Maybe we could study this a little differently instead of just pigeonholing these medications into this one subset of people who show up for a clinical trial. Like that. It's bad data collection.
It is.
But anyway.
It's bad data collection.
I'll step down off my soapbox.
All the way there. It's bad data collection, and it's not representative, but it meets their needs. It's clean data. Would you rather clean data or an accurate data? Which is it, And you can't then profess to say, you're doing everything. You would like more inclusion. You say one thing, but your action shows another, right? So
absolutely.
What are we really doing? What is it? Tell us what you mean what you say. We'll respect it either way. So, the way to fix things is that we can actually make positive changes as opposed to having to try 3 medication for one disorder on somebody. How about we include them in a study that actually tests the effect of SOAT therapy on this disease process on this ethnic group, this age group, this gender, right?
Mm-hmm.
And women medicine has really suffered.
Oh gosh.
They've only existed for eons, and there's very little study on women. And this is something that I'm making noise about. So
good.
The fabric of your society, women are not being studied enough. So whatever is on the market comes out to us and experimented, and then we find out it's causing this, it's causing that, it's causing, it's getting old. That is not nice. So there's so many things that we can talk about, and there's something that I want to talk to you about after we get off, because you said something that just felt so good. So
I'm here for you.
Thank you.
I got you.
So, just to wrap up the conversation in a sense, if somebody is at a place where they're stuck, they're like, okay, I love what I do. However, I don't like how it's making me feel. Mm-hmm. What should I do? Should I quit my job? Should I quit the career? I'm saying this because there's been study after studies that nurses are living the bedside in droves, right? Yeah. And the one thing is that nurses are not leaving bedside because they absolutely hate nursing. Nurses are leaving toxic work environments, okay?
Right.
Let's be honest, right?
Yep. So, I don't disagree with that at all.
So, spade, okay? Let's call a spade, right? Yep. So for a person who may be experiencing this dilemma, I love what I do. I want to help people. I got into this to help people. Doctors, nursing, physical therapist, occupational therapist, speech language pathologist, social workers, case manager, the whole gamut, right? Even
Mm-hmm.
nursing assistants, right? What would you say to somebody who may come to this intersection in their career and their lives and deciding, is this for me? Is this where I just pack up and leave? Or do I find an alternative that fits me better or serves
Yeah.
me better?
Yeah. Well, first, call me. So, seriously, I think that, and especially for nurses, we can't afford to lose anybody. There's already a shortage. We can't afford to lose people. I think it's so valuable to actually talk to a professional, either a coach or a career coach, or even, an old professor or an old or a nursing teacher. Just, make some of those connections that are outside of your particular friend group and work group.
Right.
Just someone who can absorb that information and actually give you some good advice and help talk you through what exactly it is you do want. We know what you don't want. You don't want the burnout. You don't want to be paid less than, your male counterpart. You're tired of this, that, and the other. So let's focus on what you do want. Let's focus on the future. Find somebody who will have that conversation with you, and then make a plan and execute the plan. And it's simple. It's not easy. It's super scary, but you might find that you don't necessarily need to leave nursing. It might be the industry, it might be the boss, or maybe it's just, putting some boundaries around your boss, whether they know it or not, whether you ever have a conversation like that. That's one of the things that I teach. Like, you don't have to have significant conversations around these people, like, hey, I need some boundaries here around the shifts that I'm working. You don't have to do that. You can do it in other ways. And there's a way to make work for you, instead of just having the constant grind and burnout, and then just not having anything left at the end of the day. There's a way to do it. But yeah, I think it's entirely okay to talk to a career coach, talk to somebody, talk to a trusted friend, and just really start exploring what the future holds, not just complaining about what you don't like.
Right.
So I would start there.
Okay. So what about the organizations? Do they have, for lack of a better word, a coach for any organization who is willing to do the work? Say, if they're losing a lot of employees, because I have a suggestion, but I'll hold it until you say something. If they're having employees leave or resign and they're having this, big turnover, is there anything that, say, a stakeholder who may be listening to us today, who's willing to implement a change to not only respect the boundaries set by their employees, but also work to improve the relationship and the culture within, their team?
Yeah, that's a tough question. It depends on what the problems actually are. So if we're
Okay.
talking about an agency, just a single agency, it really depends on what the problem of turnover actually is. Is it pay? Is it culture? Is it a company transition? Is it they're just managing to the financial statement and nothing else? Do those stakeholders just, need to be quiet and quit calling about random line items on a financial statement? It depends on, not that ever happened to me. God. That was the majority of what I did, was answer those phone calls. That was the majority of my day, by the way. It was not taking care of people. It was managing the anxieties
Right.
of investors.
That's it.
Anyway, that's all I'll say about that.
Oh, dear.
But no, it depends. That really happened.
Yeah.
Last April, you approved an invoice for $420 in the maintenance. I'm like, I don't know what that was. Are you crazy? Anyway, I can get super resentful still about all this stuff, even though I'm a year out.
I'm in this
But
thing there. It's trauma. Talk about it. Get it out.
oh, I need a coach. No, I have one actually. I think it depends on what the actual problem for the turnover is and what the actual reasons are. So, without an assessment, I really can't say, but I think it's, really figuring out what the actual problems for turnover are. And there are organizations that you can go to. People can come in and say, and have a third party actually, just a different set of eyes come in and look at what's actually going on with this culture, interviewing people, talking to people, just like you said, like having somebody, a third party come in and talk to the employees to say like what's actually going on, why are people leaving, instead of like they're going to give very different answers, line staff and nurses,
Mm-hmm.
versus the actual management, because they just have two different perspectives. So I think it's really important to understand the reasons why, and then we can go from there.
Great. That is perfect. And also the piece that I wanted to add to that is that if there is a pattern of a person or group of people identified, okay, do something.
Yeah.
Do something.
Yeah.
Yeah.
Oh, I mean, that happens too, right? There are people who should not be in management positions who are abusive. They have absolutely no business being in control of someone else's life. They got promoted to their own incompetence. They're or something. It's not okay. And yes, organizations do have to treat them just like they would any other employee. If something egregious is going on, it doesn't matter if they're an executive or a CNA. It doesn't matter. The two need to be treated equally. Otherwise, you're not going to have any respect on that team.
And it doesn't matter if your kids are in the same sports club or you have dinner and every Sunday or you have friends in common, because that is usually the outside relationships that lead to people just, doing stuff. So,
well, that's corruption.
well, you say that.
That's corruption. And no, and I, you bring up a good point in the reasons for turnover. That is a huge reason for turnover, for people leaving and just saying like, I'm not going to stand for this. I'm not going to sit here and watch somebody who's super abusive get preferential treatment over other people who are really good workers who are being abused or just leaving and going to other agencies. It's not okay.
Yeah. It's never okay. So, career life coaching. So, for everybody listening, we are going to do everybody a huge favor. So, you don't have to go and Google who is Jesseca Tighe. We're going to include all of Jessica's information in the show notes. You will have access to her website, all the offerings, how to reach out to her, how to work with her, consultation, whatever it is, you will have the information in the show notes. And we have a lot to talk about. This is just scratching the surface a little bit. She has a deep sense of the healthcare industry. She has plenty of years of experience. She is educated in that industry deeply, profoundly, and I respect all her experience and accolades and growth. So there's so much that we can talk about, that we are willing to talk about. Let us know if this was helpful, because we would love to expand on it a little more if somebody wants, or a group of people want us to focus on certain topics. But please listen, let us know, and also let us know if this was very helpful to you in any way, shape, or form. And also, this does not only have to apply to you. If you have job satisfaction, you're happy with where you are, and you know somebody or group of people who may have come to that impasse that we discussed, please share this information with them, because the main thing is that in order for you to be satisfied with what you do, you have to be happy doing it. And we want everybody to have a degree of satisfaction with what they do, the work that they do. So please share, comment, let us know what you think, and we'll have more of this beautiful conversation. Thank you, Jesseca.
Thank you so much. It was great. Thanks for having me.
Same. Thank you so much. All right, everybody. Bye-bye. We'll see you next time.
Thanks for tuning in to Unshelling Medicine Podcast. If you want to stay up to date with the latest episodes, make sure to hit that subscribe button on your favorite podcast platform. If you enjoyed today's episode, please take a moment to leave us a review. Follow us on social media at Altruistic Scribe on Instagram, TikTok, Facebook, YouTube, and LinkedIn. We share additional tips, updates, and health-related content that you won't want to miss. Have any questions or topics you'd like us to cover in future episodes? Reach out to us at altruisticscribeco.com. We're always eager to hear from our listeners and tackle the health topics that matter most to you. Until next time, stay healthy and take care.